This is Dr. Richard Bernstein with another session of Dr. Bernstein's Diabetes University. Today we're going to speak about the situation where a diabetic enters a hospital and is expected to receive intravenous glucose. We had a prior session where I spoke about vomiting and the possibility that even if you're given injected Tigan to stop the vomiting, it might not work, and you might have to, or you might start too late, and you might be already very dehydrated, and you might have to go to the hospital for intravenous saline. Or, like me, you may have to go to the hospital for elective surgery, or even for emergency surgery. And unfortunately, around the world, in most countries, it is routine for the hospital to give every entering diabetic intravenous glucose, frequently putting them into ketoacidosis, and certainly reducing the likelihood of their surviving surgery, etc., without major problems. In fact, according to the literature, the high blood sugars that they're giving diabetics who come in with a heart attack reduces the survival from heart attacks. So this is a major problem, and we're going to go into ways of avoiding it. First of all, if you're going to a hospital and if you're sick, for example, if you've been vomiting, you should try to bring a big person with a big mouth who can do the talking for you, because you might not be able to fight for yourself. And let's take the situation where you come into an emergency room and the doctor has them hook you up to intravenous glucose. Some emergency rooms will feel obliged to tell you that that's what they're doing. Others do it without even consulting you or letting you know. It's up to you or your companion to tell the doctor she should not receive intravenous glucose. She has diabetes. If you do that, you stand a chance of killing her. You could even throw in, you stand a chance of killing her and having a large lawsuit for an unnecessary death. The usual response is, well, we'll give you fructose. That won't raise your blood sugar. But it's an absolute lie. Or we'll give you lactose. That won't raise your blood sugar. Another lie. Having turned down the fructose, the glucose, and the lactose, the doctor may say, okay, we'll give you something that really has no effect on blood sugar, Ringer's solution. And most people don't know what Ringer's solution is. And he'll say, it's a balanced electrolyte solution that's very safe. But he leaves out one important fact, that Ringer's comes two ways: lactated, that is with lactose, or unlactated. And most emergency rooms don't have a choice. They only have the lactated on hand, and they'd have to send a messenger hunting around the hospital to find the unlactated. So you can reply, unlactated Ringer's would be fine, but lactated Ringer's is not acceptable. Then there's another trick. See the bag the nurse is hanging up? What does it say on it? SALINE, right? That's just what you asked for. But if you come up close to the bag that she's hanging up, you'll see in small letters it will say D5 before the saline, or D10 saline. Most commonly they'll use D10 saline. And D10 saline is really 10% dextrose, which is glucose. So you have to know what they're giving you. And I'm telling you right now that D10 saline is 10% glucose and will raise your blood sugar rapidly and probably very high if they keep dripping it in. So let's say that you bomb out with this doctor. In the United States, there's a patient's Bill of Rights. It exists, I believe, in every state in the Union, and every hospital now displays the patient's Bill of Rights. It's long, so you probably won't want to read the whole thing, but it gives the patient or the family the opportunity or the right to speak to the hospital administrator at any time. And this is important. So the big guy with the big mouth tells the doctor, I want to speak to the hospital administrator right away. It's in the patient Bill of Rights. And the doctor is supposed to connect you, or he'll tell the emergency room clerk to connect you. You get the administrator on the phone and you say, Mr. Administrator, it's lucky that you picked up the phone because you can avoid an indefensible lawsuit. Now, my patients have pulled this stunt dozens, if not hundreds of times over the past 30 years. Not once has an administrator said, oh, I'm so sorry that you're having trouble. Can I help you? Never. The answer is always, why is it indefensible? You say to the hospital administrator, you can avoid an indefensible lawsuit. And now you give him the explanation. The hospital is going to hire an expert witness for their defense. And the expert witness will probably be a specialist in diabetes. And he knows that if he goes to court and says that it's perfectly all right to give a diabetic with a normal blood sugar or an elevated blood sugar intravenous glucose, not only is the plaintiff's lawyer, your lawyer, going to rip him to shreds and make him look like an idiot, but the judge is smart enough to know that this is ridiculous. So the expert witness knows this. He's also been getting $20,000 per appearance in court from your law firm, and he doesn't want to give that up in the future. He doesn't want to look like an idiot so they won't hire him again. He's going to tell your law firm that there's no way that he can testify that this was the proper thing to do, that they should settle the case. So they don't have a witness. So you have an indefensible case. What happens? This has happened over and over again. Either the hospital administrator calls the doctor in the emergency room and yells at him over the phone, or he goes down there and yells at him. And you end up getting what you want. And this has happened every time we've gotten an administrator. What if the administrator's out to lunch? That's a potential problem. Many large hospitals have a patient advocate in the social services department, and she may or may not be effective at convincing the emergency room doctor to listen to the patient. If she's not effective, there's only one last resort that I could think of, and that has worked beautifully. First of all, you get your things together as if you're going to leave. And I neglected to say that if you ever go to the hospital, bring your own blood sugar meter, your own strips, your own insulin syringe or syringes, your own insulins. The hospital may have none of these things. Most hospitals nowadays do have accurate meters, but they don't have all the insulins, they don't have the half-unit insulin syringes, etc., that we recommend. So you bring your things, but don't let them know that you have it. If you have any essential medications like slow-release liothyronine, etc., bring them along, but again, don't let them know that you have it. You may have to administer your own meds because they may not have it in the hospital. In any event, you get ready to leave, you get your coat on, and you ask the emergency room clerk the name of the doctor who gave you the trouble, and for a piece of paper and a pen, and you write down his name and put a star next to his name. And now you want to collect some witnesses. That might be the people in the next booth at the emergency room, or it might be some nurses who heard the shouting, or it might be the emergency room clerk, but get as many names as you can. Now, once you start collecting names, out of the blue appears the nurse with the clipboard. In my hospital, they come in pairs. It's 2 nurses with clipboards, a senior one and a junior one. And their job is to prevent lawsuits and to document what has happened. So the nurse with the clipboard will ask you some questions, and you'll tell her about this, and she will remind the doctor that insurance companies will not allow personnel to remain in a hospital who have a history of causing lawsuits. A history is 1 episode. So if a doctor causes a lawsuit, even if the hospital wins, the insurance company doesn't want him on the staff. So he's going to lose his job. And once you've been fired from a hospital, you're obliged to disclose it when you apply for a job anywhere else. You're obliged to disclose it when you apply for a state license. And states may reject your license application if you've been fired from a hospital. So it gets very complicated for the doctor who's giving you the trouble. And this nurse warns him of the possibility. So in each of these cases, my patients have phoned me subsequently, laughing on the telephone because it worked so beautifully, that this little ploy can be quite effective. So I've given you several tricks for not getting glucose when you enter a hospital. We have in my book a letter that you can use when you have an elective admission with advance warning, so you can give a letter to an attending physician or surgeon, and also to the hospital administrator. So that covers it pretty well, and I hope you enjoyed this particular session. Please keep listening to our subsequent sessions of Dr. Bernstein's Diabetes University. Thanks. The bulk of what you've heard on this video appears in my book, Dr. Bernstein's Diabetes Solution, which is available at most internet and local bookstores. It is published by the Hachette Book Group. I'd like to remind you that we have monthly free teleseminars every month at the site askdrbernstein.net. Doctor is spelt DR, so askdrbernstein.net for a free monthly teleseminar. Sign up a day or two in advance so that you get a reserved seat. Good luck, and thanks for listening.